RHA stands for resilient hyaluronic acid. So it's a hyaluronic acid filler. Hyaluronic acid, we all have hyaluronic acid under our skin. It's just a sugar that we have naturally in our skin. And we can add to that sugar under our skin using these fillers to help smooth smooth lines and help restore any lost volume.
RHA is a really versatile filler. That's why I really like to use it. There are 3 different levels: RHA 2, RHA 3, and RHA 4. RHA 2 is the lightest and most flexible filler. I like using this in areas with a lot of movement, or that it's beneficial to place the filler superficially, like around the mouth, or in really fine lines, or in acne scars. Sometimes even into the lip itself, if a patient would like to have just a more hydrated and youthful appearance to the lip without adding too much volume. RHA 2 does really nicely here as well. RHA 3, on the other hand, has a little bit more structure to it. So areas I tend to treat with RHA 3 include the nasolabial folds, as well as the cheeks, as it can make these areas either give a little bit more definition or take it away, but still move very nicely. RHA 4 is a filler I like to use when I really want to give a jawline a little bit more pop, or just add a little bit more to a chin that has gotten a little bit less prominent with time. Additionally, this does really well in the cheeks, especially for someone who has a lot of structure to their face to begin with, and thicker skin in general. So any of these fillers can be used in a variety of different locations. It's up to whoever is doing the injecting to assess and determine what's going to be the best filler for you and for the issue that's being addressed.
This is a time when we're seeing our faces move on camera all the time, and so I was really happy to be able to bring in RHA into our practice as one of the first practices in Southern California early last year.
So patients always want to know what to expect after their treatment. You should always expect a little bit of swelling and possible bruising. As an injector, we always try to minimize this, but sometimes it just can happen. It will take about 2 weeks for the filler to actually completely settle into the tissue. It will integrate so nicely, and that's why I love the RHA products, is because it integrates in the tissue so well and it's movable. So when you're smiling and animating and talking, it just moves with the tissue. It's so beautiful. So, but be prepared for, possible bruising and swelling. These fillers are amazing. They last from a year to 18 months, so it's well worth the investment. Hi, my name is Jennifer Moeller. I'm a board certified PA at Newport Beach Dermatology and Plastic Surgery. I specialize in cosmetic dermatology, which focuses on injectables, fillers, neurotoxins, and lasers. Today I'm going to focus on the newest filler that's out called RHA. So we have this patient here today, Nancy, and we're going to be using the new RHA fillers, which I love. They are considered flawless in motion, meaning when we inject them, they'll actually move with animation. My goal for Nancy is going to be rebuilding some of her jawline structure here, as well as doing some in the lips and then some in the cheeks too. And in these areas, we need the filler to be mobile, meaning it moves with the tissue. Before fillers, when you injected it, they could be a little firm. They don't integrate into the tissue as nicely. It doesn't move with animation, and that's what I really like about the RHA line. What I love about the RHA line is that there are 3 different types of products that I can use. So I'll use the RH4 much deeper to provide the structure and support for parts of the face that maybe have lost that deeper support. For instance, on Nancy, along her jawline here, you can see a little bit of an impression here and a tiny bit of jowling. It's not bad, but I want to give her back that jawline, and I'm going to be putting RHA4 deep into her jawline. Now, another place I love RH4 is along in the cheek to help lift a little bit. So you see how her nasal labial fold is a little heavy? Rather than filling her here and getting her very full in the frontal face, I'll actually be injecting to lift her, if you can kind of appreciate that change when I lift. And that helps the jowl too. If you see how I lift here, notice how the jowl also lifts. So I'll be doing RH4 in the cheek as well as the jawline. I love RH3 for a tiny softening of the marionette here. Again, I won't be as deep, so the RH3 is where I'll put that. And then the lip is where I'll be putting RH2, which gives you a very nice, subtle, soft glossening. It does not give big, luscious lips. It's more of like a very nice, soft, natural, pretty lip. So as I map it out, you can kind of see that volume loss, right? So this is where I'll be putting the volume, where she's had that volume loss, and I'm gonna also put some here in the chin. I think what I'll be doing is injecting from here to lift. The way I like to inject the cheek is by using a cannula. And a cannula is basically like a little tiny straw, and it has a blunt tip on it. I'll make a port here in the mid cheek, and then I'm able to take the cannula and go in advance throughout the cheek as such, creating only one entry point. This helps minimize bruising and swelling. Oftentimes I'll switch from a cannula and I'll go to a needle when I need it to be very, very precise. So for instance, right here, the pre-gel sulcus, you can kind of see a little bit of an impression here. I will go ahead and assess the patient by pinching, and I can see there's a little bit of a fold. This is right where I'm gonna put an injection point. 1, 2, 3. Aspirate and inject a tiny bolus right there. I like to tap my patient to help her be more comfortable. It's a nice distraction. And with the RH3, I'm a little bit more superficial. I love RH2 in the lips. Very smooth, soft. It gives a nice gloss to the lip. Very natural. Nancy's been treated in the past with a little bit of lip filler. She does prefer a little bit fuller of a lip, and we're gonna do that, enhance it naturally with some RH2.
So we're with one of my lovely patients today who we're going to be helping address some of her concerns with RHA filler. Some of the areas we'll be treating today include her smile lines. So we're not going to get rid of them completely. You know, we want things to look natural, just make them a little bit softer. Also going to be treating her acne scars kind of superficially. And she has noticed that over time, she's gotten a little bit less volume kind of here in the lower face, which happens to many of us. And so we'll be putting a little bit of like RHA3 kind of both in the nasolabial fold and here, and then 2 superficially into the acne scars. And we discussed, you know, maybe doing just a very little bit of 3 just here in the cheek to take a tiny bit of weight off of the smile line so that it's balanced and not as much needs to be put into the smile line itself. Still keeping everything very natural so that when she moves and things, there's nothing that stands out, she still looks like herself. So when I treat the nasolabial folds, I like to use a cannula. So this is a little introducer. You're gonna feel a little poke. poke. So we're gonna feel where this is going. I'll have you turn your head this way. And the nice thing about using a cannula is we just use the one entry point. So now we're going to switch to RHA 2 to go into her acne scars. And this will just be doing a little direct injection. And one nice thing about doing a little filler to acne scars is it accomplishes two things. The needle helps to release some of the scar tissue, and then the filler, given that it is lifting up that skin a little bit and stimulating some collagen remodeling in the area. Even though that the filler itself diminishes a little bit over time, the tissue itself gets a little bit stronger each time and the scar gets more shallow. So it's not something you have to necessarily do your entire life for acne scars, but for a certain period of time until the desired effect is achieved. So right now you can see me moving the needle around a little bit. That's to just release some of the scar tissue, provide a little space for the filler. So one of the side effects of this type of treatment into acne scars is there'll be a little bruising afterwards because of all the little pokes. So that is not the end of the world because it can be covered with makeup. But it's just always a good thing to be aware of. I always say no photo shoots right after your acne scar treatments. At least for, give it a good 2 weeks for anything very high definition. Very nice. So as with anything with filler, you can always add more. So it's important not to overcorrect. I always go to just being right, and then we have patients come back in a couple of weeks and see if a touch-up is needed.
Hi, it's time for our demo with RHA. We have our patient here, Carrie, and we discussed, what a treatment plan for her. I can go over with you right now what we're going to do. So I'm going to mark it. I like to use a white eyeliner and mark the areas that we're going to treat. So when you look at Carrie in a profile view, you might notice that there's little hollows under the chin and a little sort of jawline that isn't probably quite as straight or strong as she would like it to be. So we're going to use a little filler right along the jawline here with the RHA and sort of fan it up under the lip as well to support the low lip. It's a nice way to support the low lip. It brings up the corners and causes illusion of a more full lip without actually putting filler in the lip. And then we can do sort of right along her jawline as well to give a stronger jawline and support the jawline there. We're going to go also along her cheek to highlight her lovely cheekbone. Just highlight that a little bit. And she has a little bit of a hollow under her eye, which is creating the illusion of a tear trough. So we're gonna fill in here a little bit for a subtle tear trough augmentation. We've discussed already that she has a little bit of skin laxity here, and so we don't want to add filler here, or it could actually highlight that. That's a mistake that people make with filler in the tear trough area or the area under the eye. So we really just want to stay low where she has this subtle hollow, and she's considering a lower blepharoplasty at another time. And little hollows in the temples that we're going to treat as well. So we're going to fill a little bit to support the lateral tail of the brow, and fill these hollows to give a more youthful shape to the face. We're going to do very small amounts of the really thin filler right along her lips and in the nasolabial folds as well, just to soften those little fine lines, but nothing too dramatic. Carrie has a very natural look, and we want to keep it that way. So we've marked our patient. We like to make our patients very comfortable, so she's used a topical numbing, and I've injected some local anesthetic into certain points in her face, and we'll use a cannula in those spots to do the injection to make it really, really comfortable. And I'm going to start with her cheek here. A little needle to form a little port or a little opening in the skin. And in the cheek, I like to use the RHA 3. That's the mid sort of thickness filler. So we're going to use the RHA 3 along her zygomatic arch. And you can see it just flows right under the skin. Patient will feel a little pressure, but how does that feel to you, Carrie?
Good.
There's actually no needle under the skin right now. It's just a flexible tube. So that minimizes any trauma to the skin. And each time I'm doing an injection, I'm using about a fifth of that. So about a tenth of a teaspoon of filler in each little small area, just to smooth things but not give any crazy kind of change. You can see it's just a little smoother under her eye, a little bit of lift here, and that's all I'm going to do on her cheek. We'll do a little temple filler. This will be what's called a depot method, so just a small injection right over the temple. And a fit athletic person, something that happens over the years is we get a little temporal hollowing, so loss of volume right in the temples. It can be a very subtly aging thing. Younger 20-somethings and younger don't have that. So we don't want to make the face round at all, but we can correct this little bit of a hollowing here, and it'll actually lift the tail of the brow a little bit and just impart a subtly, sort of more youthful shape to the face. So this will just be a little bit more of that same filler that we did in her cheek. So now we're going to move on to the low face. In the central face and in the low face, I like to use the thinner filler, the RHA 2, and that's what we'll be using in Carrie's lips and a little bit of it in her nasolabial fold. As I mentioned before, we use the slightly thicker filler, the RHA 3, in her cheekbone and temples, and a little bit supporting her tear trough as well. So here we go. I've switched back to the cannula for the lip. Makes it a lot more comfortable and smooth. This area is completely numb, so you shouldn't feel this at all. Carrie, you feeling okay?
Yeah.
Lips in general can be very sensitive, but when we use this cannula, not only is it nice for safety, but it makes it a lot more comfortable. And same idea where you turn your face just a little bit. And again, a little pressure along your upper lip. In general, this is actually the most sensitive place that we inject sometimes for our patients. But I think Carrie's very comfortable. Again, because we go slow and with this cannula. Great. So you can see a little subtle increase in volume in her lips. I'll massage it as well. And then now I've numbed the outside of her lips as well because the filler has a little numbing in it. So at the end I'll go back with the needle just in the center and she won't even feel it at all. All right, we just finished Carrie's lips. I think they look really pretty. This is a little local anesthetic there. And we used about 2/3 of a vial of the real thin filler, the RHA2, and I'm gonna use the rest of it just on her nasolabial folds. So I'll do that right now. Again, she's numb right here. We're gonna treat the chin now with, again, the thin filler. So we've gone through a vial of the RHA2. We're gonna use another one sort of in this chin area here to support the low lip. Again, with the cannula. She's already numb here. I'm using such small amounts, like a tenth of this vial. And then we'll go right along the jawline as well. All right, we finished our treatment today of Carrie. How did it go for you?
Good, really good. It was painless.
Really?
Very easy, yes.
Okay, good. Good. So we used, let's see, almost 4 vials of filler today on Carrie. 2 of the RHA2 and 2 of the RHA3. So we used the thinner filler sort of in this area to just highlight her lips, a little bit along the nasolabial folds and along the chin. And then we used the thicker ones, you know, along the jawbone and along the structural support of her face. 4 vials is less than a teaspoon. It's about 2/3 of a teaspoon of filler spread over this large area. So that's why it still looks natural. It looks like you. Nobody will know that anything was done.
Yes.
I don't think you'll have any significant downtime. The cannula, you can see little marks sort of just right here and right here, right here. These are little local anesthetic blebs that will go down in 10 or 20 minutes. If you have any bruising, you might have a couple teeny tiny ones, but I don't think you'll have any significant bruising. And generally this will last for a year to a year and a half.
Wow.
Yeah.
That looks amazing. Thank you so much.
Oh yeah,
I love it.
absolutely.